course, back to school, a lot of
Yes.
parents going through the checklist, especially for health-related reasons. Immunizations is also very important here in the state of Alabama. Some of them are required for kids to attend public school. So I just want to start off, when it comes to those immunizations, why are they so important, especially for kids?
Well, it's important because a lot of the times when you're exposed with multiple kids, everyone has their different medical conditions, right? Not all kids can be immunized for whatever reason. So it could be because they have some form of medical condition that prevent them. So the kids that can get immunized, then it offers what we call like a herd immunity. So just recommending vaccines, it's good for you, but it also is good for the others who are unable to get vaccine.
You spoke especially for herd immunity for something especially like measles that can cause an outbreak if potentially in the right scenario. What does it mean? You already talked about this a little bit, but that herd immunity, especially in an environment where kids are all together in pretty small rooms, how important is it so those diseases or infections don't spread?
It's very important. With kids, I work a lot with toddlers. They lick the walls, they lick the floors. So it's very important for us to do what we're able to do because at the end of the day, they're just going to be doing everything. So for us, we are able to give the vaccine so we can try to build that immunity so that when they do all these different things like eating dirt and licking all these different particles, then it doesn't have hopefully that much effect on them.
Yeah, and of course you mentioned some of those diseases. Chickenpox also another one that's especially with kids. I was just speaking with a doctor from the ADPH, and she was talking about some of the cases she's seeing, especially with chickenpox. That's a disease again that can easily spread in an environment. What does it mean to be able to to tell parents like, hey, it's either a quick shot for the kid or potentially scarring and other impacts on the body that could last a lifetime.
Yes, and I know sometimes it might be difficult because at the end of the day, no one wants to see their baby in pain. But I like to reinforce that pain, that local tenderness or pain that they're feeling is very temporary, right? Versus the side effects that you might get from an illness, that can be chronic and it can be prolonged. So just to do like a quick vaccine, we can try to treat that with the medications or the Tylenol, Motrin, make the child comfortable versus long-term run where we can have all the the sequelae of the side effects.
And of course, with some of these immunizations, some of them, they don't all happen all at one time, and they're usually either one shot or two shots, depending on them. And so when it comes to, hey, it's not exactly like, hey, this is every single year. A lot of these are often one-time, immunizations. I guess, can you talk about, why, hey, it's just going to be one time and why it's important just to get that one-time shot?
Yeah, so a lot of the times, especially in the first couple of months, the vaccine seems a little bit redundant because you come at your 2 months, your 4 months, your 6 months, and it's pretty much the same shots that you're getting, but it's kind of like a booster effect. Now, once as you get older, like with your 1-year-old, with your MMRV, your mom's measles, rubella, varicella shot, you turn 4, you get another one. But after a while, you shouldn't really need another shot unless in special scenarios.
But I guess just kind of add on to that,
Yeah.
with because some parents might think they think, oh, I have
It's
to
like
get
an
this
every
every year,
year.
like the flu vaccine, where
Correct.
of course.
Okay,
So
gotcha.
just kind of saying like, hey, this is for some most of these immunizations, this is
It's
a
like
one-time
a
deal.
one-time thing, yes.
Yeah.
And I do reinforce that with some of the parents because especially now where everyone's trying to be a little bit more involved and aware with the vaccination, I do reinforce that, hey, for certain vaccinations, it's just going to be a one-time thing. Another example would be like your meningococcal. That's not something that you're expected to get every year, like as you said, your flu. So I think sometimes saying that and reinforcing it does offer some form of comfort. And it sometimes just reinforce. You need to reinforce everything and it just repetition and just kind of offering them that comfort. Sometimes they just want to hear it multiple times for it to really like cement.
Yeah. And of course, for a lot of parents, there might be concern because, and this is something I also asked the ATPH because, there's often, a lot of, concerns like, hey, should I get my kids get these vaccines? I guess from your perspective, when you're talking with parents, what do you often tell them?
In terms of like why to get the vaccines?
Yes.
Well, multiple reasons, and it really depends on the vaccine itself, right? So for example, right now there are a couple outbreaks, like with measles cases. So for now, when I have a 4-year-old that comes in, I will, let the parents know, like, hey, there are outbreaks. Yes, the different states have different outbreaks, but in order to prevent that, I'll try to encourage it. But then you have like your other vaccines with like your HPV, where some parents are still a little bit skeptical about, especially again, it depends on the scenario, right? A lot of people think, unless you're a certain age group, you shouldn't get the HPV, or a lot of times people think if you're a male, you shouldn't get it. But I do still encourage patients like, hey, this is why we're recommending these things. I think just having a simple conversation sometimes it does clear up a lot of confusion or misconceptions.
Of course, when kids see the needle and they see, yeah, they might freak out a little bit. For some parents, they might say, okay, that's a good reason we're not going to do this. How important is that temporary pain instead of lifelong pain potentially?
It's again like seeing your baby cry, like it can be traumatizing, obviously for the child, but for the parent. So just to give them the comforting measures, like hey, if you see the swelling, if you see the redness, this is what you can do. It does offer them some form of comfort. And honestly, popsicles they're cures for everything. A child can be crying, you give them a popsicle, and all of a sudden they're good. So it's just really to know how to maneuver the situation and make them feel comfortable.
Can you just talk about, why immunizations are needed here in the state of Alabama for kids to attend school?
Certainly, as a pediatrician of 49 years, I can say that I have seen a lot of diseases go away in my career as the result of successes of immunizations. So it's very important for parents to protect their children against these communicable diseases, both from an individual basis and also the risk of being exposed to this disease or exposing other people to these diseases in an environment such as a school. So this is a protective and preventive measure. And I just want to say, I think that the parents of Alabama are doing a very good job. We actually, with our measles vaccine for the 24-25 school year, had a 95.2% vaccination rate for kindergarten, and that is really significant. And I think if the parents of Alabama just continue to speak with their pediatrician or their family physician about the importance of vaccines, most of these vaccines are generational vaccines, they've been around a long time, then they will be able to make the best decisions to protect the health and well-being of their children.
And you spoke a little bit about the vaccines that are needed. Can you kind of list out the ones that are required?
Again, the vaccines that we recommend for starting school for getting the certificate of immunization, again, we're talking about regular school, kindergarten, and up. What we're really talking about, first of all, is the diphtheria, pertussis, tetanus. Again, that's actually a single shot, but it's three antigens in it. So again, diphtheria being a respiratory disease that we really have not seen in the United States in many years, but is still quite prevalent in other countries, especially Eastern Europe. Certainly tetanus, I think most people are familiar with tetanus. When you were young, your mother was no doubt step on a nail and have to have a tetanus shot. Of course, if you already had your tetanus shot, you should be protected again if you've had your series of tetanus shots. So again, tetanus being a very severe disease, a very severe neurologic disease, and can be fatal. And again, pertussis, which is also a respiratory disease. And right now we're using what's called the acellular pertussis vaccine, which is less likely to cause a local reaction or skin reaction after having the vaccine, but perhaps not quite as effective as the old whole cell vaccine. I'm not saying wholesale, I'm saying whole, W-H-O-L-E, second word cell, C-E-L-L. But nevertheless, we see outbreaks of pertussis, and they're particularly bothersome and particularly severe in very young infants. That's actually why we want our young children to be protected, but we also want their siblings protected. And we do recommend actually a single Tdap for adults because we want women to be protected during pregnancy, as well as, again, grandparents that might be visiting their grandchildren. So that's a little off topic of school, but still important. The polio vaccine, again, polio, primarily a neurologic disease. When I was a young child, my mother was adamant that we could not go to the swimming pools in the summer. We could not be in large crowds. She had a great fear of polio. My dad was so excited about the polio vaccine coming out in the late 50s. and then the oral polio vaccine in the early 60s. And the reason he was so excited about it is he was born in 1912. So he had seen children with polio. It's very, very grateful that his kids did not have to get exposed to that. The other vaccine that we recommend is actually measles, mumps, rubella. It's in a single dose. We do recommend 2 doses in childhood. Again, these vaccines have to be given in series, but the MMR vaccine, measles, mumps, rubella. And again, just to speak to measles, which we've seen a lot of cases in the United States, fortunately in Alabama, we've only had 2 cases. Again, shout out to the parents of the children of Alabama for being informed and taking care of their kids. Again, measles can be a very severe disease. It can cause secondary infections. Certainly, people can get respiratory infections from measles. They can get severe ear infections from measles. They can get encephalitis or a brain infection from measles. And then later on, measles, 10, 12 years down the road after you've had it, can cause a very severe disease called SSPE, subacute sclerosing panencephalitis. That's really a mouthful. Well, we want to prevent that. It's rare, but again, if we get those measles vaccines, we're not going to have outbreaks in Alabama. We're not going to have kids not being able to go to school because they're sick, parents missing work, outbreaks in the schools, because again, our parents in Alabama are informing themselves. Again, measles, mumps, rubella. Mumps also, a pretty significant disease. I know people think of it in terms of swelling of the face because it really affects the glands of the body. Other glands can be infected, and mumps actually has a propensity also for some urologic complications, specifically actually complications of inflammation with the cerebellum, which actually can cause balance problems. I used to see mumps when I was a very young physician in my residency with kids that would come in with, a cerebellitis. And again, they would not be able to walk. They would be staggering as a result of having this infection. So again, mumps we can do away with. Just to mention rubella, rubella can actually be a very mild illness in childhood, but the issue is pregnant women get rubella. Rubella is teratogenic to the fetus, and by that I mean it can cause fetal abnormalities. And one specific concern that we have is kids that are exposed to rubella in utero because their mother is not immune to rubella can have congenital deafness. So again, rubella, while maybe not as severe, you have it yourself, but again, it can be teratogenic. That's why we want to protect children and also protect young girls so that when they get older and get married, children, certainly they're protected during their pregnancy and will not have problems with children developing rubella. And finally, chickenpox is probably the new kid on the block for what I call the generational vaccines, but it's been out for 30 years, the varicella vaccine. And again, a lot of people, I had chickenpox, and see, I've got a scar here and a scar there. Chickenpox also can cause some very severe illnesses. Again, I go back to the type of encephalitis that can occur from chickenpox. There is a rare but significant disorder that can even be fatal called REYES, REYES syndrome. We see that when I was a younger physician, and of course saw that with kids that had chickenpox, and they've also been given aspirin. So again, we really want to prevent that fatal disease. And finally, chickenpox, something that people don't really think about sometimes with it, is can get really severe, significant invasive cellulitis or invasive skin infections. I saw a child, and these kids live in my memory, I saw a child when I was in residency that had a severe skin infection that covered a very large portion of the chest. I mean, this child was septic and in extreme distress. Fortunately, this child lived, and this child lived because of rapid medical intervention for a secondary complication of a disease that's preventable. So again, diphtheria, tetanus pertussis, polio, measles, mumps, rubella, and varicella. These are the vaccines that are needed in order to get a certificate of immunization in the state of Alabama.
All right, thank you so much. And so, I want to kind of add on to that because you mentioned how parents are becoming more informed here in the state of Alabama, but there are still some parents who always have concerns. What are your response to those parents, to say, well, I'm not sure if I need my kids to get all these?
As a pediatrician of many years' experience, I have had, I guess one might say, the advantage of seeing most of these diseases. Now, I've actually never seen a case of diphtheria, I've never seen a case of tetanus, and I've never seen a case of polio. But the rest of them, I've seen all these diseases. So what I can say to parents, and what I do say to parents, whom I encourage to ask your questions, is that these vaccines, again, they're generational. They've been around for a long time. They have a very high safety profile. The effectiveness of vaccines ranges depending on which vaccine it is. For example, probably the most effective vaccine in terms of effectiveness of not getting disease is actually the measles, mumps, rubella vaccine. Really, the measles vaccine, you get 2 doses, and you're 97, 98, 99% unlikely to get measles disease. We go back to the mumps component, mumps vaccine, probably only about 85, 88% effective, but still, that's pretty good. So I think when we look at the overall effectiveness of vaccines, again, they're generational vaccines. They've been around a long time. They have a good safety profile. A lot of the parents probably took these vaccines themselves because, again, many of these vaccines started to be given in the 50s and 60s, but, much more so in the 70s, 80s, and 90s and up to the present day. So that's one thing. The safety is there for these vaccines. In addition, the preventive data is there. Kids have not suffered these diseases. And having seen, again, some of the complications of these diseases, the generation of physicians before me were familiar with what's called an iron lung for people who develop paralysis from polio. And I think the last iron lung patient died in the United States not too long ago. They were older than I am. So again, just to keep in mind that your child not having to suffer these diseases reduces the risk, again, of the child not only having the disease, but having secondary complications from that disease. And something else as a parent, someone has to stay at home with these children if they're sick. So parents miss work, or if a child has to be hospitalized. There may be kids in the hospital that have immunosuppressive conditions such as childhood cancers. They may be on certain drugs. Hospitals have to take extreme precautions that these immunosuppressed kids don't contract one of these diseases. So, these are things, and I have parents say, well, frankly, I've had people say, well, you're trying to scare me. I'm trying to educate because I don't want to see children suffer from diseases that they don't have to have. Now, people, oh, well, my grandparents had this and they were all right. Well, your grandparents had this and they may have been all right, but their kid down the street, their friend, had this and either suffered complication and a life-altering complication. I've known people who had polio and have had restrictions or severe complications as a result of that, or your friend down the street may have died. So again, we don't see these diseases. We don't have to see these diseases in the United States. And, I do bring up something the parents don't bring it up. I bring it up myself. We have good data that shows that these generational vaccines do not cause autism. In fact, I get it pointed out to me from time to time, well, a study that was done in the late 90s with measles vaccine, that study was debunked. That doctor lost his medical license, his ability to practice medicine and take care of patients. These diseases do cause a lot of complications, a lot of problems if you get them, and it can cause death, and they don't cause autism. So, I want parents to ask questions, and, our younger generations of pediatricians, they want parents to ask questions. But at the end of the day, we pediatricians take this, I think, as seriously as any specialist in medicine, because we've either seen this or we've studied it, and we don't want children to suffer, and we don't want people to die.
All right, that was a great answer, and thank you so much. And this is my final question. I don't want to take up any more of your time, but you know, you kind of hinted, so you kind of talked a little bit about this. Talking about how important it is so diseases don't spread. When I was a kid, I'm from here in North Alabama. I remember when swine flu just overtook the schools in the late 2000s. How important is it for these vaccines so we don't have something similar like that happen again, where about an outbreak happens in a school?
Certainly, influenza vaccine, while it is not required to get a certificate of immunization, I highly recommend influenza vaccine. And again, there are other vaccines that we highly recommend that are not requirements for certificates of immunization. But since you asked about influenza, let's just talk about that. Every year we see during the influenza season, and we may see a couple of really major peaks of influenza, high absences from school. What we don't see is if kids have been vaccinated, while they might still get influenza, because influenza is not one of our highest effectiveness vaccines, but we see less illness in terms of times out of school. Even if they have influenza, they're out of school less time than the kids who are not vaccinated. We see less secondary complications in kids that have been vaccinated, such as kids can get pneumonia, kids can get ear infection if they get influenza. We see that less in vaccinated children. And again, I go back to having the kids in the school, because not only do they need to be there to learn, but parents have to go to work. So, that can be really significant. One thing I do want to go back to and mention when we talk about outbreaks is we have been, again, so fortunate in Alabama so far about measles. And a measles outbreak is very costly to the citizens of Alabama. Certainly, it's costly to parents. First of all, you don't want your kid to suffer. Secondly, you don't want to miss work. I mean, obviously, you need to be at work. I mean, most people, when you have jobs, they need jobs to support their family. But the third aspect of it is if your child is not vaccinated and has to miss school, that just expands that problem. And I think another aspect of that is that we, as the state health department, we have to bring in epidemiologists, we have to bring in nurses, we have to engage our physicians, we have to engage the private medical community to try to contain an outbreak, not to mention the burden that then also puts on medical providers, including our emergency rooms and our hospitals. And having thousands of people sick with measles and attendant complications and even death, again, that is extremely costly to our healthcare system. I mean, just imagine you have a kid come into the ER that's got measles. Now, fortunately, in Alabama, we've got a very highly vaccinated population, and that's, again, I want to keep it that way. But that kid comes in the ER and they have measles or suspect measles. Okay, the ER has to take extra precautions to protect the patients around that person, because in case they have an immunosuppressed person in there, someone that's not vaccinated, not fully vaccinated, another kid that's not old enough to be vaccinated, they have to take extra precautions. They have to take extra infection control precautions. They have to block a room. So then you've got a room out of service there, and that ER is full, and they need their rooms to see patients. The physician, the nurse practitioner, the nurses have to take extra time. They're having to use their personal protective preventive measures themselves. So it's just not only a terrible thing for children, but it's very costly. And in this time in healthcare, all of us want to reduce our costs. So I think, while as a physician, on the one hand, the cost is not my first priority, I have to think about that in terms of how that affects the citizens of the state, how that affects our healthcare system, and our ability to render care to other people who need those healthcare services.